Good evening, everyone. Thank you for being here this evening. Dr. Eccles is here with me this evening. Of course, Public Safety Director Jimmy Edwards is also here with me this evening. We learned about an hour ago, a little over an hour ago, that the city of St. Louis has its first positive case of COVID-19. Dr. Eccles is going to visit with you about as much information as we're able to reveal to you about it. And with that, I'll turn it over to Dr. Eccles.
All right, thank you, Mayor. Good evening, everyone. Today we're here to inform you about new development, which is we have the city of St. Louis has detected its first case of COVID-19. The individual returned to the United States from a country that has evidence of ongoing transmission. They flew into an airport in another state. Upon the landing, they transported or drove down to the city of St. Louis. However, in transit, they were in communication with the medical facility. The medical facility contacted the health department, and the health department specifically instructed them to go directly to the medical facility to receive care, evaluation, and treatment. At that time, the individuals did meet the criteria for testing that has been established by the Centers for Disease Control and Prevention. Testing was conducted, and the specimens were tested by the Missouri Department of Health and Senior Services. And again, around 5:15 today, we received notice that the specimens were tested positive for COVID-19. It's really important to note that the individuals followed the instructions given by the City of St. Louis Department of Health, and because of this, there are no additional exposures. And so no other individuals are at risk from developing COVID-19 from this individual, again, because they followed the instructions that were given to them by the City of St. Louis Department of Health. At this time, we continue to urge everyone to be mindful of the preventive measures that we continue to emphasize day in and day out, so they can minimize their risk for becoming infected with COVID-19. And those simple measures are, one, staying home if you're sick, covering your mouth when you cough and sneeze, washing your hands regularly with soap and water. If soap and water is not available, use hand sanitizer that has at least 60% alcohol. Again, these measures have proven to be effective year in and year out, particularly during the influenza season. And so we continue to make sure that individuals are aware of these simple measures that they can implement to prevent the spread of COVID-19.